So if they're insulin sensitive, but they're on more than 20 units a day of the long-acting, you'll increase by 20%, which is that third column listed there. Oh, and here it says that for type 1, an endocrinologist must be consulted prior to any insulin adjustments, and that's just because they are more insulin sensitive. And they require bolus insulin. A type 1 has to have bolus insulin. So making changes to basal has to take that into account. So you want to continue to titrate the type 2's diabetics insulin dose until their fasting sugars are less than 120. And we've had some real success stories with this program that patients have just had a huge decrease in their hemoglobin A1C and are doing much better because of it. If the patient is on Lantus and they have good fasting morning sugars, but they have high sugars later in the day, go ahead and let the diabetes educator and the endocrinologist know because we've got other problems to solve. If the patient is on NPH and their fasting sugars are high, continue to titrate both. If they are on NPH and their fastings are normal, but their sugars are high later in the day, let us know, because we can help you titrate that morning NPH dose. Let's see, I'm just reading through this quickly. So if you are concerned about a patient, they're having sugars greater than 300, they're reporting polyuria to you, know that there's a physician available and that patient may need to come in to be seen. If someone has hypoglycemia, mild hypoglycemia, like in the 60 to 80 range, that can't be explained because they went out and ran a marathon that day or are particularly active, go ahead and decrease their insulin by 10%. If the patient has severe hypoglycemia, that's less than 60, or they are unable to treat the hypoglycemia themselves, titrate down 20% and let the physician who's around know about that. Do you guys have any questions so far? Obviously, all of this will be available to you. Yes?
I just have, so after you get their glucose readings,
Mm-hmm.
do you typically have like a few minutes to just make these decisions, or do you just keep them hanging on the line?
I don't know. What do you do?
So some people say, let me call you back in a minute or so, and then they go ahead and do the calculation. Once you get more comfortable with it, we have on our Google Doc, we actually have a blood glucose average calculator. So we type in the numbers as they tell us, and then it averages out because you have that little function in there. And then we put the protocol right there on the calculator so we can quickly see it. And based on if they had hypoglycemia or not, we could say, oh, well, your average is this, so you can go up or not go up. It's up to you. Whatever.
So it says something like consult endocrinologist before doing some of the ones in the protocol.
Yes.
So would that be something you'd have to maybe email the endocrinologist and call them back the next day, or
So
we
we
have to call them back?
have an endocrinologist who comes every Tuesday night, so I think the
Okay.
students come in on Tuesday night. His name is Helmi Saragi. Have you guys been asking him questions when he's there?
Sometimes.
Sometimes. He's there.
Haven't had to ask.
And you guys are always welcome to email me if you want to troubleshoot a patient. I'm happy to do that. Chris knows how to get in touch with me as well. So if you ever want to troubleshoot what to do, I'm happy to do that. But they're almost, I think, pretty much every night there is an internist or a family medicine doc who could help you troubleshoot. And I think every Tuesday night, Dr. Shiragi's coming. And once a month, there are additional endocrinologists there as well when we have an endocrine night. So there should be physicians available should you need us. Anything else?
Jessica?
Yes.
Is it okay if I give your 5-minute warning just because Molly has to go for
Sure.
40 minutes too?
Sure. Yes. So we can go through some pretend cases in the protocol. Yeah, I have no idea how long we've been here. So yeah, this is just practice at this point. Do you guys have any other questions about the protocol or about diabetes before we just run through some practice cases?
So I was just wondering, are most of the patients continuing from the ones that we've had all along, or are,
So I guess the idea is those patients will continue,
Okay.
and you'll continue to get new
because
referrals.
mostly, I feel like there are a few patients that have really, they're kind of at a very steady state now, and so, and I think some of them at least are wondering, well, you know,
We have to
What
keep getting a
now?
call every Tuesday night.
well, not even that,
Mhm.
but just what now? I know of like a couple that are even wondering like, how can I maybe even get off this insulin? So they're
Mhm.
kind of bringing in exercise and weight
Mhm.
loss into the, and I know the protocol focuses much more on people that are
Hyper.
coming with hyperglycemia, but there's less, I think, guidance on what to do with someone who's at a very,
Mm-hmm.
who's kind of come down and now they're very steady and
Mhm.
they're just kind of wondering.
Mm-hmm. So I
What
would
now?
say that they probably at that point need to see a physician to help answer those questions. I think that from your standpoint, you can encourage the diet and exercise, and that is always a mainstay treatment of diabetes all of the time. And if their sugars are starting to be consistently low normal, then you could just show us the numbers and we could help you titrate things down. But if it's more complicated than that, such as they're developing regular hypoglycemia because they're doing so well, then they maybe need to come back in to see us. Does that answer your question?
And I just had another question about, most of these patients are getting their insulin and medications from the free clinic.
Yes.
And so, just like really briefly, that process is that they pick it up here and pay for it here from the pharmacy here.
Yes.
And I'm just asking that because
I don't think
had
they pay for it. I think it's free.
Okay.
Though
'Cause
they
I
pick
just-
it up here from the pharmacy here.
Okay.
Mhm.
I just wanted to ask because there were just a few times when there was like a medication issue where they're like, I don't have my medicine, but then obviously we're not able to provide them with their
Mhm.
medicine, so I just wanted to make sure that they're getting all their medications
They need to physically
from
come
here.
to the free clinic to get it here.
Okay.
And anyone who's a patient here can get insulin here. So.
Mhm. And like the hours are
I
the
don't-
normal clinic hours for pickup, or that's
Yes.
that information.
I know the pharmacy's open during normal
Okay.
clinic hours. I don't know if they're open other.
For pickup, I forget the exact hours, but right there at the front desk is a little slip. It's like a orange pinkish slip that says what time they can pick it up. I think it's like 10 to 3 or something
Okay.
like that. So it's not like all day they can come pick it up. But,
All right.
and sometimes they get behind. Like I think there was a shortage on insulin, so a lot of patients kind of went without.
Okay.
Other questions? So I'll let Molly go ahead and go, and then depending on time at the end and how long you guys want to stay, if you want to go through some practice cases, we can, and if we don't, we won't.